Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. If this is the first time you're watching one of my procedures, please do feel free to like, comment, share, and also please do subscribe to the channel if you're on YouTube, or follow the page if you're on Facebook. We have a client here who attended with bilateral. So when we say bilateral, we mean both ears, fully occluding. So the term occluding is when the ear canal itself is completely sealed with earwax. There's no opening, it's not partially blocked, it's fully occluding. So there's an acoustic seal, there's a plug of wax and skin all the way around the ear canal. We're in the left ear at the moment, and you can see this wax is quite wet. The patient had been using, I believe, sodium bicarbonate earwax drops in this ear. There's also quite a lot of hair at the entrance. Patient was male and we're put in the elderly category. You tend to find that male patients of a certain age do tend to have a lot of hair. Could also be due to ethnicity as well. I also find a lot of Asian, so I'm Asian myself. I do have a bit of hair in my ears, and so that can be a common trait. Sometimes people ask, why don't you cut the hairs? Well, the hairs doesn't affect me. I know it doesn't always make the best of viewing because you get a lot of reflection from the hair strands. But trimming these hairs, they're only going to grow back, they're going to grow back a lot quicker than the earwax itself will secrete and migrate. So quite often a question is, well, if you remove the hairs from the ear, well, that could possibly stop the earwax forming because the wax is matting against the hairs. Now, yes, excessive hair can cause earwax to mat, but if we were to trim this, the hairs will grow back within, I would say, a month or two. And for earwax migrates at a rate of around 3.5 millimeters a month. So it's very similar to your fingernails, the growth rate. And if you imagine the average length of an ear canal, if you just say it's 3 centimeters, just to make it a bit easier. So, and let's just say the migration of earwax out of the ear is 3 millimeters a month. So you're looking at 10 months for wax to and dead skin from the eardrum to shed, migrate, and come outwards. So it's kind of a pointless exercise because these hairs will grow back in no time and be much quicker than when the wax will be lateral near the entrance. So I've managed to get a suction grip here, and you can see I'm tugging. I'm trying to bring this forwards, but it is lodged, and it's a bit like a tug of war. And it's lodged because this plug of wax, and also there's a lot of dead keratin, a lot of dead skin in this plug. It's lodged very deep into the ear canal. So the ear canal anatomy, again, let's just say on average it's about 3 centimeters. It's actually on average 2.6 centimeters, but for argument's sake, let's just round it off to 3 centimeters. And you can split the ear canal into thirds. The outer third is made up of cartilage with some muscle, some fatty tissue, and the skin that lines the outer third of the ear canals about 1 millimeter in thickness. So I'll come back to the moment. I'm just using an ear hook now, and I'm just getting in and behind this wax and dead skin and extracting it forwards, and it's literally hanging out of the ear now. So it's a big plug here. And then the inner 2/3 of the ear canals, it's literally a very thin layer of skin. We're looking less than 0.1 millimeters in thickness layer of skin. And that's adhered tightly to the bony part of the ear canal. And there's also 2 bends in the ear canal. The first bend is about 0.5 centimeter into the ear canal, and the second bend is where the bony part and the cartilaginous part of the ear canal meet, so about 1 centimeter into the ear canal. And at that juncture, we call it the osseo-cartilaginous juncture. The ear canal also narrows slightly, it's called an isthmus. And then we have a second isthmus deeper into the ear canal, about 0.5 centimeter away from the eardrum. So the ear canal narrows about 0.5 centimeter away from the eardrum, and it protrudes back outwards. And this plug of wax and dead skin was really plugged really deep medially against that second isthmus near the eardrum. So it's quite a job bringing it forwards, but we just managed that. So I'm just mopping up now with the Zollner suction probe. And you can see these hairs, so it's only the outer third of the ear canal that contains the hair follicles. so you don't get hair strands on the inner tooth edge, and you'll see that you've probably noticed that. So these hairs are all around near the entrance and into about 1 centimetre into the ear canal, and after that there's no hairs. Any hairs that are in there are loose hairs that have been pushed in, or they've had it from their beard, or had a haircut, the barbers, these loose hairs have entered the ear canal. So we're into the right ear now, and this plug of wax and dead skin is a bit more firm, it's a bit more harder. The patient hadn't been using drops on this side, and it's almost like I need a hammer and a chisel for this one. And again, we know we're near the entrance of the ear canal because you can see all these hairs, and hairs do reflect the light, and so does very hard and dry earwax. The light shines off it, you get a reflection, whereas the wax is very soft and gooey, it absorbs a lot of light. So I've just used an ear hook, but I'm just now using a Jobson horn, so it's like a correct, it's like a spoon, almost like a shovel with a little hole in there. So we managed to get a bit of the dry wax there. This plug of wax is a bit more matted, there's a lot more hair adhered to the wax. So I'm just using the Jobson horn, gently kind of digging into the core of this plug, but not all the way down, because then we'll make contact with the floor canal, and that would be very uncomfortable for the client when bringing the correct forwards. I'll be scraping the base of the ear canal and bruising it and potentially causing bleeding. So I've just gone back in with the ear hook. Again, I'm just trying to dig into the core. So it's very dry, crumbly, hard earwax here. I managed to get a segment out there. I just dissected it. So in a moment, I'm going to use some Henkel Forceps. So Henkel Forceps are a bit different to crocodile forceps. Crocodile forceps, they are a bit narrower in the diameter. So I think the diameter is about 7mm, the large one. And they have a serrated grip, just like crocodile teeth. With Henkel Forceps, they don't have any serrations. You can see I'm just bringing this out. So Henkel Forceps, how would you best describe it? I'm trying to think. Imagine you've got 2 spoons, and so imagine when you have 2 spoons and you're using that to take salad out of the bowl. And so you put one on top of each other, on the other, in the opposite plane. So, and you kind of create almost like a whale's mouth. Using the 2 spoons, and that's what Henkel forceps are like. They've got a larger surface area, so it enables more grip. They're generally used to remove objects from the nasal cavity. If a child's put Maltese up their nose, that's what Henkel forceps generally used for, but you can also use it for the ear. I've been told that I use a lot of food analogies. I do apologise if you're eating and watching this. I'm a bit of a foodie, hence probably why. And I hope you enjoyed that video. You saw a still image there. And we weighed the wax. It's quite a big haul. It's just under 800 milligrams. I hope you're all enjoying your afternoon, evening, morning, wherever you're watching this. And I shall upload some more videos in due course. Take care. Bye.